First, let's welcome Dr. Kaylan Edwards of Novant Health Pediatrics Brunswick. Dr. Edwards, thanks for coming on the show again. I'm so excited to have you here.
Thanks for having me.
You're quite welcome. Some of our viewers may not have met you the first few times you were on, so let's remind them a little bit about your background and your education.
So it's Kaylan Edwards, and I grew up outside of Raleigh. My family is all from Whiteville, so I spent a lot of my time.
You say it right, too.
Yeah, Whiteville. I spent a lot of my childhood really in Columbus County and Brunswick County. I went to college in Raleigh at Meredith College, and then went to East Carolina for all of my medical education as well as my residency.
Great.
Yeah.
Yeah. Well, we have this new practice called Novant Health Pediatrics Brunswick.
Yes.
So tell me a little bit about the practice.
So we open on August 21st, and we have a nice new space where...
Really cute furniture, too.
Yes, it's awesome. We're very excited to be here. We had a great open house back in October. Got to see a lot of kids in the community. We have 2 physicians in our office, and we're seeing children of all ages from birth all the way really through college.
Tell us again where it's located.
So we are on Highway 17 going south. After you pass the hospital and go through Supply, we're on the right-hand side. It's called Brunswick Medical Center, and we're in the big brick building on the 2nd floor.
And you have a partner there, Dr.
Yes.
Lori Tackman.
Yes.
Correct?
Dr. Tackman came from the Triangle. She has years of experience. She previously was serving as the head of the nursery at several of the hospitals in Raleigh for a local private practice. So she saw all their babies, so that's a big asset to us here.
Yeah, really.
Yeah.
Well, the holidays are almost upon us, so today we're going to talk a little bit about safety and health tips. So I was wondering if there's something, some ideas that you might have about how to keep our kids safer during those holidays. But let's start with travel.
Yes.
So I know that there's a lot of car traveling this time of year. So let's talk about car seats and things like that.
Yes. So the big thing with car travel is making sure that we're in the right car seats and we're in them as long as we should be. So every child should be in a rear-facing car seat until they're 2 years old. Some parents ask if they're folding their legs up or kicking the back seat, but that's what the American Academy of Pediatrics recommends is the safest for the child is until 2 years old. Then they can be forward-facing. The safest place for your child to be is in the back middle seat of the car. Some parents ask, well, what if we have multiple children?
Yes.
So, you know, put one in the middle and then put one on one of the sides is the best you can do. And then I also remind parents that all children should be in the back seat until they're 13 years old, which seems kind of old, especially for some of our taller kids, but it's really the safest place for them to ride in the back seat until they're 13.
Oh, wow.
Yes.
Well, I think car seat guidelines, they seem to change frequently. Right. Is there a source, a resource for finding out about what you should be doing?
Yes. So the best place I go and I tell parents about for the most up-to-date information is healthychildren.org, and it's sponsored by the American Academy of Pediatrics. And it has tons of good information on it, but you can just go there and search for car seat safety.
Really?
And it'll bring up everything. It has links to different car seat manufacturers and things like that.
I know they're kind of hard to install.
Yes.
And I think there are folks around who can help you do that.
Right.
Usually fire departments and people like that. So.
Yes. The website has good instructions for putting the car seat in, but I always encourage parents, if it's the first time you've done it and it's your first baby, better be safe than sorry. The fire department's more than happy to help.
Yeah, good. All right, so the family has arrived at their destination now. So let's talk about keeping kids healthy at family gatherings and things. What can you recommend in terms of food and?
Yes. So there's a few big points I tell families. So hand washing is key.
Oh, yes.
Making sure all hands are washed before any meals are served, before any food goes in the mouth. It seems kind of plain and simple, but there's a lot of eating around the holidays, and so just making sure that always happens. Another thing is making sure kids aren't sharing cups, which is sometimes hard to do. But you know, cold and flu season, it just passes around. A big thing is for everyone to make sure they get their flu shot to help make sure everyone's protected, because cousins and children and everybody have been in daycares, so you've been exposed to numerous children, and then they all get together and share it. So the flu shot is really key for all family members, even protecting our little ones. How
about toy safety? This time of year, a lot of shopping going on. How do you stay on top of all that information?
So again, healthychildren.org actually has a great page about toy safety, and it has links to the national centers that monitor safety of toys that are manufactured. So in the United States, we actually have very strict guidelines about how toys can be manufactured, and that is reviewed before they're actually put on the shelves when they come in. Healthychildren.org is a place that stays updated regularly.
Oh, that's great.
And so it has all sorts of toys.
That seems to have everything you need to know about safety and
it is.
And
it's
such.
Wonderful.
So that seems like a great website.
Yes.
How about behavior this time of year? How do you control? You've got all these people around these gatherings and grandmas, and everybody's giving the kid a different guideline to go by.
So the biggest thing I tell parents is, as much as we don't sometimes see that, children like to have a routine. So children really do better when they have a routine. And so even if you're traveling across different time zones to different areas, things like that, it's best to try to keep children on their routine. Sometimes it's hard to do, especially with waking up and going to bed, staying in different places, sometimes being in a hotel, but trying to keep them on their routine as much as possible, and just asking grandparents, aunts and uncles that even though you love them so much, the best thing to do for them is try to create an environment to keep them on a routine.
Well, that's all really great information. Before we wrap up, is there anything else you'd like to add?
I like to tell parents, if they have any questions, talk to their pediatrician. You can give any of us a call. That's why we do what we do. If you don't have a pediatrician, then we're happy to answer questions, and you can come see us. We're accepting new patients.
Awesome. That's awesome. Well, thank you so much for coming today, and we look forward to having you back when it's springtime, and we're going to talk about all the things that happen to kids in the summer.
Yes.
Thanks again, Kaylan.
Thank you.